I'm Dr. Sarah Wasserbauer. Here at my offices, we do everything having to do with hair. We put hair back on the front of your head and reframe your face. We put eyelashes back, eyebrows back. We take hair off of places that you don't want it. Basically, I think that we give patients back their dignity. When patients are losing their hair and going bald, they really have lost that essential part of themselves, and we give it back to them.
I just enjoy life more because I'm so relaxed and self-confident about my hair.
It's going to definitely make you look younger. It's going to give you some more confidence and just generally make you feel better about yourself.
I am proud of what we are able to do here at my office. We have cutting-edge technology that nobody else can match. And we also do some of the rarer procedures here. But what I really like is what we've been able to do for the majority of our patients, which is reframe their face, give them their hair back, but also give them their dignity back. The people I hire are technically experts. They can do this better than anybody around. And that's actually what drives us. We like our patients, so we want to be technically expert. We want to be aesthetically the best in the business.
Yeah, like a lot of guys, I started to lose my hair when I was really young. I was 17 when it was first noticeable. So it was pretty devastating for me being that young. I met Dr. Wasserbauer in my mid-20s, and since then I've had 3 hair transplants with her, and I would never go back. I really never realized how much I had missed my hair until I have it back now.
A follicular unit is the smallest unit of hair that you can transplant and have the appearance be as dense and as natural as possible. And that's why a follicular unit is important. In the past, they used to transplant hair in these big plugs. And I hate to say it, but plug is a 4-letter word in my practice. So is pain, incidentally. But the follicular unit is what makes hair transplant these days possible. It gives you the most natural result. It gives you the densest hair that you can possibly have in a single session. And that's what gives people that wonderful look. When a patient comes in, we look at what's best for them, whether it's a medical approach or a surgical approach or a combination of the two. We really need to do what's best for the patient. Sometimes that's not surgery, and we'll send them home on Propecia and Rogaine. Other times their hair has progressed to the point where they really can't get any benefit from those medications, and in that case, we go directly to surgery.
When I initially came in and saw Dr. Wasserbauer, she made me feel real comfortable, and she gave me a good evaluation and basically told me what she thought she could do for me, and I felt confident enough about that I scheduled my restoration appointment a month later.
When picking a hair surgeon, it's important not to have that personal connection, someone you trust, but also someone who has extensive experience, especially someone who would be board certified by the American Board of Hair Restoration Surgery, fellowship trained, and somebody who makes the practice of hair restoration surgery their whole practice.
All I can say is that every woman who has male pattern baldness postmenopausal and has these issues, to be a patient of Dr. Sarah's and come in and have this problem taken care of in such a wonderful, supportive environment is the best thing that you can do for yourself, because it frees you for the rest of your life to be rid of that anxiousness about your hair.
I love being able to come to work and give people what they really need. They want their hair back, and that's why I like to say I've never worked a day in my entire life. This is my passion, and my patients' goals are my goals.